Welcome, everyone. It's lovely to see so many of you in the room here today. Congratulations for taking part in the Big Splash WA if you've joined up. And if you haven't, we hope that this seminar will give you a little bit more information and that you'll get as excited as the schools that are already on board. So we'd like to also welcome our far-flung guests who are here by teleconference. So thank you for dialing in. You are all very important supporters and drivers of this crucial campaign, and the value you place on your students' mental health and well-being is very encouraging. As you can see, there. Apologies, we're having a little technical difficulty. Sorry for those far away. There we go. So, as you can see from this slide behind me, you can see how far the project has already spread. So we have schools on board from as far away as Christmas Island, all the way over to Kalgoorlie, the Goldfields, and down to Esperance. And we do hope to get the north on board soon. So along with you metro schools, the regions are really well represented, which is wonderful. Of course, our aim is to reach every student in every school in WA. That's over 1,100 schools. While not every school can have a dolphin sculpture, we will have other ways for them to engage in this vibrant and important mental health and wellbeing campaign. More on that later. Before we hear from our speakers, a little housekeeping. So the toilets are outside and to the right. Our exits are at the main door and here on my right. And in case of emergency, please follow the Perth Children's Hospital Foundation staff in their lovely purple t-shirts. As always, please switch your mobile to silent before we start. Thank you. I'd like to now introduce two very important ladies. Dr. Caroline Goossens, the Director of Clinical Services, and Julie McCormick, Senior Clinical Psychologist, both of whom are members of the Child and Adolescent Mental Health Service team here at Perth Princess Margaret Hospital. Their passion for working with young people battling mental health problems is truly inspiring. They have worked alongside the Perth Children's Hospital Foundation team every step of the way, reminding us that prevention and early intervention are crucial to reducing the numbers of children and young people that they treat. We will also be showing a video testimonial from our lovely Ambassador Tegan and her parents. They have generously shared their experiences to help highlight the essential work of the Child and Adolescent Mental Health Services. Caroline, can I please hand over to you? Thank you.
I'm just going to get next. So I have got a bit of presentation envy. My slides are terribly boring. Julie has got all the fun bits, so I was complaining to her. I'm providing a bit of the overall context of why we've done this campaign and why we're so enthusiastic to partner with the Foundation. I really like to acknowledge them. And before I start my presentation, I'd just like to acknowledge the traditional owners of the land on which we're meeting, the Whadjuk people of the Noongar Nation, and pay my respects to their elders, past, present and future, and thank them for their contribution to the country in which we live. So, this campaign is really a response to concern around children and young people's mental health. It's been widely acknowledged that it's not only our concern, but young people themselves, it's their top concern. The Commissioner for Children and Young People set up an inquiry into the mental health and wellbeing of children back in 2011 because everywhere she went, children and young people reported that was their major concern in life. It was noted in that inquiry that there was a general lack of understanding in the community that children do have mental health disorders. There's kind of a desire perhaps to not acknowledge that or to minimise it because it's a painful thing to perhaps to understand. That inquiry resulted in 54 recommendations that really aim to increase the priority to a lot of different initiatives about mental health and wellbeing in children and adolescents. By way of background, there was also the Ombudsman inquiry in WA, and that looked at the deaths of 36 young people in the preceding couple of years who had either died by suicide or were suspected to have died by suicide. And it was an interesting timing that review occurred, because from 2009 onwards we had an increased rate of death by suicide in WA of young people. When they looked at that group of 36, and they looked at them in quite a lot of detail, not surprisingly, really significant mental health problems were identified in the 36 young people. 1/3 had actually had a diagnosis that had been confirmed, but 40% of young people had actually been self-harming prior to the death by suicide. 60% of those young people were recorded as either having had thoughts about attempting or completing suicide. More than half were recorded as having communicated that to either a friend, a family member, a health professional, and nearly half of them had tried before. Of that sobering group, we had 4 different groups that they identified. There were 20 young people who'd had really significant experiences of child maltreatment or abuse, and 8 out of those 20 had contacts with mental health services, but many of them didn't have sufficiently intense or enduring contact. In the second group, there were 5 young people who had quite complex mental health histories, with a parent who'd been diagnosed with mental illness, and they didn't have that past history of child maltreatment. Group 3 worried everyone. There were 6 young people who were really quite high achievers, and they didn't have the demographic or risk factors that were associated with significant mental health problems, and there was little warning of the suicides. And then the last group were 5 young people who were very impulsive, and although they didn't have established mental health disorders, they had demonstrated impulsive suicidal behaviour and substance use, and none had had contact with mental health services. And as a result of that, one of the things that the Ombudsman really recommended, particularly around the group with little warning, was that in collaboration with relevant stakeholders, really the Mental Health Commission should be considering whether it was appropriate to undertake or facilitate mental health literacy and suicide prevention activities for those young people who didn't have a lot of factors associated with their death. So that provides a bit of a background. I know suicide by young people is the very end point of some of the things that we're talking about. And when we're looking at mental health, we're looking at a really broad spectrum of issues around well-being that leads up to some difficulties, severe difficulties, and is associated in that context with suicide. But I think it can give us a context in which to work backwards to think, if we're looking at this end stage problem, what can we do much earlier on to prevent us getting there? The other big report that's occurred that I think provides us with our context is the second big survey of mental health and wellbeing that was conducted and led by our own Telethon Kids Institute. And I'm going to call it the Young Minds Matter survey. It's a bit of a mouthful otherwise. It's the largest national survey, the most reliable, with the best data, which was supported by an NH and MRC grant. It interviewed 6,000 families and actually undertook diagnostic interviews of children and young people. And so it looked at how prevalent mental health disorders were, what kind of services kids were getting through to. They interviewed young people and found out from them what they thought about it all and any changes over time. So almost 1 in 7 children from 4 onwards up to 17 were assessed as having mental health disorders in the preceding 12 months. Boys a bit more likely than girls. You can see that in the under 12s and over 12s. So of those 1 in, and it's really relevant to think that by the age of 12, almost 50% of mental health disorders that are going to occur in someone's lifetime have already occurred. And of these 1 in 7, 1 in 7 will also go on to have enduring mental health problems in adulthood. So I think it's really important for us to start to think. Obviously, we need to start very early with these kind of things. The types and range of mental health disorders, there's attention deficit hyperactivity disorder, anxiety disorders that range from simple phobias through to separation anxiety, generalised anxiety disorders and obsessive compulsive disorder, depression, behavioural disorders and conduct disorder, eating disorders. And the trend line is that in the younger children, so if you're looking from 0 up to 12, but really in this study around the 4+, it tends to be milder in presentation with less severe impact, although you can have severe mental health disorders. Whereas as you get towards adolescence, you get a much higher rate or percentage of children and young people with severe disorders. The impact. So 1 in 7 of those young children with a disorder were severe in nature. And that's equivalent to about 2% or approximately 82,000 Australian children and adolescents. If you're looking at adolescents themselves, they're almost 3 times more likely to have a severe disorder, as I was describing, compared to the younger children. And what was a bit concerning in the study was that the prevalence of major depression has increased over time, so it's more likely to be occurring. And we know it's major depression that has a greater impact on functioning than the other disorders. So you've got almost 40% of cases being severe and another 35% being assessed as moderate. So as I said, depression's increased overall. It's 8% of 11 to 17-year-olds, more in girls than boys. It's got the highest association with psychological distress and severest impact on functioning, with school attendance, capacity to work when you're at school or be engaged in educational activities, really big impact on capacity to have friendships, family relationships, and their developing sense of self-worth. It was also associated, when we asked the adolescents, with their parents not really knowing much about how they were feeling. And what was really interesting was that for many of the adolescents who reached diagnostic caseness with quite a severe disorder, there were parents those same parents really underestimated how severely impacted their child was. So there was very poor rating, or that it didn't come together well, which is something to be really aware of, that it can be very common for parents to be unaware of the severity of how a young person is feeling. And the other concerning thing about major depression is it's associated with the highest risks of harm to self. So in this study, we had 7% of 12 to 17-year-olds who'd seriously considered attempting suicide in the previous 12 months. So if I'm just thinking of you teachers, that's a significant number of young people in your year group that you might be teaching. 5% had made a plan, and 2.5% had actually recorded having attempted to kill themselves in the previous 12 months. But if you've got major depression, that goes up to almost half. And a quarter who had attempted it. Suicide is now the leading cause of preventable death in 15 to 19-year-olds. So it's a really pretty significant problem for us in our society. And obviously, when you're looking at suicide, as I said before, that's really the tip of the iceberg. It's the very severe end point. Underneath that is an enormous amount of distress and young people who might be presenting with self-harm to clinical services. Underneath that is an even bigger group who are probably in the community and haven't made their way to services. One of the things that really concerned us when we read this report was that only half of these children with mental health disorders got to any kind of service. The rest are just kind of bubbling along. And the other thing that really worried us was that they might not have got to the right service. So they might have accessed some kind of help, but they weren't signposted to the service that was kind of appropriate for their level of severity. So for overall, only 3% of those with the disorder get to one of our services as a specialist service. And when we asked the researchers to dig into in WA, well, of those with a severe mental health disorder, how many are getting to specialist mental health? It was only 10%. So I think that really tells you something about the perhaps the lack of signposting, the lack of clear clinical pathways, which I think is really concerning. The most common reasons for not seeking help or receiving more help that the young people themselves identified is still this idea of stigma and also some things related to poor mental health literacy. So 60% of them were worried what other people might think. They were also concerned about having to speak to a stranger. They were hopeful the problem would get better on its own. And they thought, look, I'll just kind of work it out on my own with either a friend or help from family and friends. One of the things we know about adolescents when they're trying to work it out with their friends is none of them are terribly good at knowing when to call it. To kind of go, look, there's a developmental drive in adolescence to try and keep things away from adults, isn't there? To kind of work things out together, which we understand. But when it gets to the point of having a really serious mental health problem, particularly one that's associated with risk, we really need to be able to educate our adolescents. That's when the barrier's reached and you talk to an adult to get help that's more appropriate. It's often very sad when you are involved in a situation where there's been either a near miss or a death by suicide, and you talk to the young people who knew the young person. Something has appeared previously on either social media or in interactions with other young people, and no one has really been able to raise the alarm because it stayed locked in that peer group, which is very sad and I think very difficult for them afterwards. So that's something that we really need to work on, I think. So of the barriers, I think the difficulties with stigma are arguably more common with parents than with their children. A lot of parents want to protect and shield their children and feel that if mental health issues were identified, they're really worried that they'll be stigmatised or they'll be labelled, or it'll be sort of the school will see them as having a problem which isn't going to get better or go away. And that anxiety often prevents them from accessing help. And even when they do come to our services, sometimes there's a real reluctance, and we have to work with that to get schools involved, even though it's absolutely vital that schools are involved. There's also, I think, as a parent, and I can agree with this, that talking to your child about mental health issues is difficult. You want to protect them from even a knowledge of that sometimes. And I think it's often a surprise about how much they already know and that they haven't shared with you when you actually do start the conversation. There's a lack of knowledge, as I've alluded to previously, about how to get help. And if in any kind of environment a suicide has occurred, it's often shrouded in secrecy. But what is going on where there isn't an open conversation about it is the children and young people are all talking about it to each other, often on social media. And not having openness about it means that there isn't a chance for more positive and constructive messages to get through, and there isn't a chance to set up really clear pathways to help for other students who might be at risk or other children and young people. So what is so important about school, and why has this campaign really trying to engage schools? Well, first of all, school's often the place that mental health symptoms are identified. 1 in 5 of the young people that get to services are referred by school, not anyone else. And I think there's a lot more where school raise it with the parent that leads to the referral. We know that major depression's got the greatest impact on school functioning and attendance. And we know that there's a lot of young people that are getting informal support at school. Children and adolescents spend the bulk of their waking hours with you. You have an enormous influence, and I think that schools increasingly are being seen as community hubs. It's not just a place for delivery of the 3 Rs or just traditional education. Far more is being demanded of schools and expected, I think. Schools lead initiatives to improve prevention and intervene early in all sorts of health issues, and increasingly now in mental health issues. And I think schools really set the cultural tone in terms of how we think, not thing, about wellbeing and mental health. So if schools can have an open, and a capacity to talk and think about wellbeing and mental health, it really does set the cultural tone for children and their attitudes about their own thoughts and feelings and how they're going to access help if they need it. So why the Big Splash campaign? I sort of think it's a fantastic campaign. It's a really fun and creative way to raise awareness and to begin conversations about wellbeing and mental health. The aim of it really is to highlight, educate and empower schools and families to talk openly and confidently about wellbeing and mental health issues. And it provides a platform for schools and families to work together to improve literacy, to build resilience and support intervention and recovery from mental health issues. So I'm about to hand over back to Deirdre, but I'm going to talk. I know that Julie, who's one of our senior clinical psychologists, has worked really hard with the foundation staff to develop the packs for schools, and she's going to be showing you some of the material from those packs. I'm also aware we've got representation here to talk a little bit about the framework for mental health literacy in schools and Mind Matters as well. So I'll pass back to you. Thank you. Yes. So Tegan is a young person who's accessed our services and has recovered and was really happy to be the ambassador of this campaign, and hopefully can give a very hopeful message. For some people, it's a distressing thing to watch, and I would just encourage schools, if you're going to use the video, to really think about your cohort of kids that you're going to show it to, and consider whether it's appropriate or how to lead into it. Okay, thank you.
When I was 12 to 13, I started to develop anorexia nervosa. I was diagnosed when I was 13. Then for the next 4 or 5 years, I was trying to deal with that, plus depression, OCD, anxiety. And then after I got over anorexia, I developed binge eating and bulimia. They had assessed Tegan and they said, okay, she's part of eating disorders program. I just thought thank you and grateful, and then as it went on, we were then provided with opportunities for the family counselling, with individual counselling, with counselling with myself and just my girls, fathers groups, mothers groups, there was schooling, there was just everything that then I thought, okay, I felt a lot safer and I had people to go to, and even if Tegan didn't feel that she was safe, I felt she was safe. They gave me tools to separate myself from what was going on inside my head. They brought me back to reality. They made me realise that I was a person outside of my mental health, that I was still a teenager, and that I should be going out with friends, that I shouldn't be sitting at home, stuck in bed, that I could recover.
This funding is an amazing opportunity for us to develop innovative programs for young people that are going to help engage them in the work they need to do, and are going to help them have a holistic recovery.
To me, this is no different to if someone has been diagnosed with a cancer or an illness that could be treated or cured. You know, if that was your loved one and something could save them, what would you do?
There's no doubt that in my mind that when she attempted suicide for the first time, that was rock bottom. Because she meant it as well. She saw no value in her being on this planet. She was of no value to anybody. Why should she take up space here?
It's still a death sentence for some people, and it's long term, but the help is there and the support's there, and I feel very happy that and quite confident that Tegan will make a happy and strong, long life for herself. But if we hadn't have been here, that wouldn't have been the case. I've got friends now that are going through depression, and I've lost friends to depression, so being able to do this and potentially help people who I don't even know, that is invaluable. Without a doubt, they saved my life. Without a doubt.
Our peer mentors at the hospital now working to help other young people who are currently in the midst of mental health issues. So what I'd like to do to start off with is to ask you all to stand up for a minute. Thank you. Now, please sit down if you or a family member have experienced something in terms of mental health. And then sit down if you know a friend or a colleague who's experienced something with mental health. That's what we'd expect, isn't it? Mental health struggles affect all of us, personally or through our relationships. And if there had been someone left standing, I would have said, sit down if you've ever felt sadness or anger, distress. These are universal experiences. So in this discussion about mental health, you might feel uncomfortable, but that's normal. And you might think about yourself or other people that you know. And so I ask you in this discussion today and all the ones going forth to be aware of and track your own responses, because we need to take care of ourselves and other people when we're talking about mental health and emotional well-being. The work can be stressful. Watching young people grow through their delights and their trials, it's difficult. And in terms of the work, we must first take care of ourselves. Self-care is oxygen mask when it comes to mental health. We need to put it on ourselves first. When Deirdre asked me to get involved in the Big Splash a year or so ago, I was delighted. And that's before I knew of the work that was involved. My main work with children and families has up to this point been in the middle of a mental health crisis. The opportunity to contribute to prevent distress, harm, death, it's an opportunity I couldn't really say no to. It's very welcome. And to help open up the conversation, we wanted a symbol that we could connect with, something that would make us feel positive about mental health, to get us in a space that other people would want to join in. Now, for those of you who drive into Fremantle, often like I do, have you seen the dark octopus that the council thought would be a good idea to welcome people to Fremantle? That would probably be a less than ideal symbol in this case. So you can imagine it was easy not to choose the octopus, a jellyfish, a shark, a stingray. The dolphin was chosen because we connect positively with dolphins. We might even idealise them. They're viewed as safe, sociable, unique personalities, playful, fun. This is what we wanted for the Big Splash. And when I asked young people and parents who've previously experienced mental health conditions what came to mind when thinking about dolphins and mental health, these are some of the things they said. I particularly like the last quote that comes from Tegan, who was talking about the invisible sound waves, the sending out of signals that we don't often see. And I'm thinking of those 5 young people who died who weren't on our radar, I guess. So we took the idea of the dolphin and got creative. Recent research from my home country, New Zealand, found that engaging in creative activities is connected to emotional well-being. From early childhood, children use creative play to explore and express feelings, to communicate with others, to problem solve, to develop their imaginations. I have a 4-year-old daughter, so I get to watch this every day. In this picture, she tells me we see a puma with a lion in their stomach. Perhaps my daughter is exploring relationships of power in the animal kingdom, perhaps her own power or appetite. Who knows, but she tells me she is the puma. Creativity is also central to identity, to culture, to resilience and recovery. There's a lovely clip from Kids Matter about the artist, which I encourage you to look up, hearing from a young Indigenous woman talking about her journey of creativity and identity. Creativity has also been central to my own work in mental health, which in the early years was rather a challenge to me because I'm naturally inclined towards maths and science. However, my therapy room looked like a studio after quite some time. And through art and drama, writing and music, I've witnessed and supported children and young people to explore their feelings, their identity, their ideas. And I have seen creativity take a really central role in the recovery of many and in helping make sense of their anxiety and depression and other distress. I really like this image and words from the Black Dog Project, written by a young woman I worked with for around about 5 years in terms of what creativity meant for her. And I think words often fail young people with mental health disorders, but art can communicate a lot. So we have placed creativity at the centre of the big splash in the dolphin art and in the educational kits. Having a 4-year-old, I'm also fighting off another bug, so excuse my voice. Relationships are also central to emotional well-being and mental health, and never more so than in childhood. Parents, family members, friends provide the belonging, the support, the role modelling, the guidance that children need to grow into emotionally competent adults. And relationships are also vital for the recognition, the support and the recovery for those actually suffering. So in the big splash education packs, we provide guidance and support for parents. And we know that through parent involvement, we can see real and lasting impact. In terms of community, if we are to actually really get behind the stigma, to create a society where people can talk about emotions, distress and mental health freely, and to access the support they need, we need community engagement and cultural change. I'm sure we all have our own vision of this. For me, I imagine living where we can discuss emotional pain as easily as we can discuss physical pain, where I go to my GP and I get an assessment of my emotional health and hygiene, a fact sheet and a suite of treatment options. For Amelia Bloom, one of the many faces of the Black Dog Project in WA, she imagines a world where there's a worry bank on every corner. I want to think a little bit about the kits now because we're very excited to have them. We've got a series of kits all colour-coded with different year groups from kindy to year 12. Each kit has a series of activities for students based on the dolphin, fun dolphin facts and links to support. There's also guides for teachers and parents to help them use them at the classroom and at home. For the younger age group, the content focuses more on emotional well-being, and for the later groups, it includes this but also extends into mental health content. The content and the language of each kit's been tailored to the specific age groups, and we would encourage you to think about the kits in relation to your cohort. It could work to tailor the younger kits to the older age groups, but we wouldn't like to see the older ones made available to the younger ones. We've sort of done the content in terms of building on each other. And we encourage you to get familiar with the content and the options and to have fun and be creative in how you use them in your particular settings. There are links to curriculum and extension ideas in there that a group of school psychologists and teachers helped us create. So let's take a look at some of the activities. For the first activity for kindy kids, the first idea is to start to learn and recognise emotions. So I want us to just have a little go with that here. Who is able to tell me what emotion, there's no right or wrong here too, what this chap might be feeling? Joy? Yeah? Okay. And here? Can someone shout out? Angry? Yeah? Yeah. Surprise, yes. Yeah. Sadness, I heard. Yeah, yeah, yeah. So you might not have had the big splash activity in your childhood, but it sounds like most of the group are pretty good at reading emotions. Yeah. What about this one? What did people say? Mischievous. Yeah. I put my 4-year-old through the test yesterday, and she was in keeping with all of you in terms of reading that. I thought she might say happy with that one, but no, she said mischievous. Mind you, she likes to be. Emotional vocabulary is critical to communication, and so there's lots of activities in the Big Splash helping building up children's language to help them express themselves. And the kits also encourage teachers and parents to role model the use of emotional language and to do so in day-to-day conversations, also utilising books and media. There's some books recommended in the kits, including Dr. Seuss's The Many Coloured Days. For middle primary school, there is the fantastic resource that Disney spent several billion making, but you can also look at YouTube and just take out little 1-minute segments that can lead to some quite good conversations. If you Google YouTube Inside Out, Meet the Emotions, this lovely little clip goes through 6 different emotions, and it extends on the names. It tells you the purposes of the different emotions, so fear to protect you, that sort of thing. We've used lots of playful marine metaphors throughout the Big Splash with the aim of providing practical tools and everyday sort of language to connect people to talk about these. There's a series of activities centred around the idea of the emotion wave. So we encourage children to think about feelings like waves in the ocean, that we can't stop them coming, not permanent, they come and go. And like a wave, they change and pass and can learn to be surfed, so children don't get dumped or wiped out by their emotions. This is a very much approach of welcoming and accepting emotions. Lots of our culture gives us messages to get away from them, to hide, to get rid of them. And there are lots of ideas in our culture about emotional well-being, and we learn these from our own families, our cultures, our early childhoods, and it's really helpful when teaching and parenting to take a moment to reflect on our own attitudes and our own values, because these will come across and what we think is helpful. The blowing of steam metaphor is another one that we've played within the Big Splash. It's often everyday language in terms of stress management and psychological therapies. Links nicely to the Dolphin's idea of the blowhole. And one of the classroom activities suggests looking at a little clip of a blowhole, viewing pictures of the dolphins breathing, and then exploring the metaphor. So asking the group different questions such as, what does blowing off steam mean to you? What are some ways that you try to blow off steam? What are some less helpful ways to blow off steam? And getting the kids to be talking about that. Empathy we also tackle quite early on. There's a really cute Sesame Street clip on empathy, again that I test drove via my daughter, and it's a very fun, light-hearted way to start thinking about empathy. We're seeing increasing research to show that empathy is more vital than any form of academic engagement in terms of long-term success. And I guess what I want to emphasise today is that it does have a vital role for parents and teachers who care for children, and the best way to actually teach empathy is to do it, to actually show empathy in everyday conversations and everyday interactions. So as well as all the very fun and useful resources out there, actually being empathic will go a long, long way. But with the big splash, we want people to feel confident to talk about the distressing and the difficult parts of life. For younger children, we're emphasising talking about feelings, relationships, friendships. For older children, we're also adding direct talk about mental health, looking at barriers to help seeking and finding ways around them. And to give you a flavour, one activity looks at myth busting. This is sort of heading into year 7 and 9. Before I move to my slide, anyone got an idea of a myth of mental health that you come across quite often? Anyone got a thought what might be behind some of the stigma? Can't be cured, yep. Or the other one that we often hear that goes alongside that is snap out of it, yeah. So there's a lot, and I think there might even be some more in terms of gender, but there's a lot that really create the stigma and the discrimination that's getting in the way of help seeking, and without help seeking that's getting in the way of recovery. So that the activity that we've got in the big splash actually gets young people to think about myths. So what is a myth? How is it formed? How does it spread? In what way is it harmful? And then looking at how to correct myths and what they can do in terms of spreading the word. Another activity focuses in on help seeking. So again, this is with the older age group. Little children, we want them to be talking to their parents and to their teachers. Older children, you're adding in the role of friendships and online and professional people. So as well as stigma and discrimination, a lack of literacy and knowledge seeking is a big barrier to seeking help. So the Big Splash wants to acknowledge the role of schools, pastoral care, traditional health services, but we're also aware that young people, often their first point of call is the internet. So one of the activities, we are getting young people to take a look at the various sites that are available and to explore the content and evaluate the usefulness. And at the very older age group, sort of year 10 to 12, often they have their ideas already in place about mental health, about emotional well-being. So what we need for that particular group is more the community participation, the advocacy, the Big Splash challenges, which I think we're going to hear Deirdre talk about. If we get young people actively engaging in activities, getting involved in promotion or advocacy, then that creates a cognitive dissonance. They're having to speak and embody the ideas that they don't necessarily believe, and that is likely to have a bigger impact in that age group than just sort of educational intervention. So for that group, we need humour, we need visibility, active engagement, and preferably use of social media as well. This little YouTube, which if I had the technology I'd torture you with, is a bunch of young people from New Orleans doing what they call the Dolphin Dance. So if any of you are really dying to see this particular clip, you can Google Dolphin Dance and you'll see all sorts of delights about what people can do with their bodies, which look nothing like what I've seen in the waters of the Swan, but certainly they were having a lot of fun, and through social media it was really getting a lot of attention. So just to finish off with some sort of hints and tips in terms of getting the most out of the packs for the classroom, just being aware of any school policies, resources and supports. When you start talking about mental health, you're likely to get distressed young people in disclosures. So being welcoming of that, that's great, but being ready to help. Trying to get all the students involved and active, but being aware that some young people are really suffering and they will be gaining something just from listening and perhaps pointing them to outside or other resources that they might want to use. Creating a safe and compassionate culture. So often group rules in classroom discussions or using your homeroom to talk about respect, confidentiality, conversation limits, that kind of thing's helpful. Pointing kids in the direction of where they might want to take particular issues, abuse, self-harm and suicide. Generally, it wouldn't be a great idea for too much personal detail about those topics in groups. Sort of talking more universal than personal when it comes to those particular topics, but being well aware they're coming and helping young people take those conversations where they need to. For every day, be aware that you're a role model in emotional well-being and mental health, whether you like it or not. They're watching, I'm sure they're listening. So there's a lot of messages, a lot of everyday messages that we provide, and being aware of our own values and communicating positively as much as we can. And in everyday relationships, showing students that you care, that you can listen, that you're trustworthy, that non-judgmental acceptance. Maintaining boundaries. Some young people need an awful lot of help and support, so being aware that you can't be everything to everyone and keeping an eye on boundaries. Also want to really highlight parent engagement. Certainly that's a big focus of Kids Matter and Minds Matter, getting school and parent partnerships in terms of mental health. The Big Splash has, for all of the activities, parent guides, so that parents can keep the ideas and conversations going at home. And if you can take out of those and pop them into school newsletters or Facebook updates or however you like to communicate with parents, but there's lots of resources in there. We encourage you to have that positive partnership with parents so that, and particularly in the smooth waters, so if things do go wrong, that you're already on a good sort of standing point to talk about distress. And also being aware that, and this is probably a very obvious point, but I'm going to say it in terms of mental health, blame and shame are huge because of those myths that we're talking about. So being really aware that parents and family members are likely to blame themselves and communicating a really non-judgmental stance when you're talking with parents, particularly if things are going wrong. And probably the most important request is that we don't want to just make a drop in the ocean with the Big Splash. We want to make a long-standing ripple. So really pleased that you're going to hear from Kids Matter and Mind Matters in terms of taking these ideas. I guess we're hoping the Big Splash is a bit of a pointer to the ongoing resources and frameworks. So grateful we're going to hear about some more from them today. Thank you.
Thank you, Julie and Caroline. Now, before I introduce Linda Cunningham from the Principals Institute Associate, I would like to introduce you briefly to Connor, who is filming today's event. And we have a brief request. If you could all please stand and just give a quick wave to Connor and let him know that you're supporting us on this campaign. That would be wonderful. If you have a flyer near you, please put it up, and hands up in the sky for supportive children's mental health awareness. Thank you. Hands in the air. Thank you. Wonderful. Thank you, everyone. Hey, Linda. Now, I'd like to introduce Linda Cunningham. Sorry, my apologies. I'd like to introduce Linda Cumming from Principals Australia Institute, and she will say a few words about Mind Matters and Kid Matters. And these are national strategic frameworks that both Caroline and Julie encourage schools to adopt. Thank you. Welcome, Linda.
Thank you very much, Ruth. And yes, you've pretty much covered my introduction, so thank you for that. Yes, Principals Australia Institute is a national organisation, as many of you know, and they are the delivery arm for the national initiatives Kids Matter Primary and Mind Matters, so Mind Matters being the secondary initiative. I could even put on, let me just scroll down to that one. I could even add on Kids Matter Early Childhood, which is run by Early Childhood Australia, and that can come in front of or even before Kids Matter Primary, so that we have this continuum of support starting from birth with the Early Childhood Kids Matter, and then providing that structure and framework for early years, and then into the schools from the primary through into the secondary, to provide schools with a framework, information, resources and ongoing support as they develop and implement a mental health and wellbeing strategy that works and fits with the context of their particular school. So central to the framework that really makes up Kids Matter Primary and Mind Matters is a 4-component framework that is, of course, evidence-based, based on research, and really reinforces a lot of the statistics and information that we've already heard from Caroline and Julie this afternoon. So central to that, just very briefly, for those of you who don't know or aren't familiar with Kids Matter and Mind Matters, the 4-component framework, the very first component across Kids Matter Primary and Mind Matters is all about positive school community. So it's that positive culture that that Caroline was alluding to, you know, that focus for schools to really look at what they're already doing, because a lot of it is acknowledging the very positive actions that schools are already engaged in, to look at what they're doing to really strengthen the relationships and to build that sense of belonging and connection for everyone in the school community. So it really comes to building the awareness, the knowledge, so that then you can have that shared language and shared approach. And that goes, of course, when we're talking whole school community, from the students, staff, families, and then also out to the wider school community as well. So from building the relationships, that really is the foundation that everything else is built upon. So the second component, looking at the social and emotional skills, which Julie was mentioning just previously in some of those visuals, and component 3, working with parents and carers. Once again, acknowledge the importance of the involvement and understanding with the parent group as well. And finally, the 4th component is that specific support that the school is doing and can maybe strengthen around that identification of students with mental health issues, and then the policies, procedures that are in place in the school to support those children. So that's a real brief summary of the 4-component framework, and it's freely available. The websites, if you haven't already discovered them, the Kids Matter Primary website, Mind Matters websites are freely available, being federally funded. All of the resources are there free and available. Our services for schools that maybe are already implementing or are keen to find out more and maybe to receive some support with the implementation, or just purely to find out more information, we're available as well, and that's all freely available to schools. So jump on the websites, Kids Matter Primary and Mind Matters, find out more. There's online professional learning resources, and then webinars coming up if you'd like to get involved, or come and see me at the end of the session and I can provide you with more information. So hopefully that's given you a little bit of an insight into the frameworks, and for those already involved, the Big Splash is a wonderful program to really to strengthen the work that you're doing. If you're not already involved, then the Big Splash might give you that opportunity to explore and maybe strengthen the school strategies that you've got in place or starting to embed. So thank you for your time. Thank you. Back to that one, yes.
Thank you, Linda. So now we've heard from those working daily with children who are in need, and it's time to ask the big question. No one wants to see the alarming figures rise any further. How can we, as educators, parents and concerned adults, help to turn the tide? When Caroline approached the Perth Children's Hospital Foundation, the main fundraising body of the Children's Hospital, to ask for help and assistance, she also wanted to reach kids long before they ever need medical help. As explained, early intervention and awareness play a huge role to achieve positive outcomes. All our children need to hear 3 key messages. You are not alone. It's okay to talk about your feelings and concerns. Real help is available. So we need to get that message out there to parents, through the schools, through community, and through projects and wonderful campaigns like the Big Splash WA. So the foundation partnered with Wild and Art to create the Big Splash WA. And I'll just bring up some wonderful images here of some of their work. So, as you can see, they will capture the attention of as many Western Australians as possible. Wild and Art is famed throughout the world for their eye-catching public art. So, as you can see, there are lots of different options. So they helped create vibrant sculpture art trails through towns and cities, uniting communities and sparking conversations. In January next year, the Perth CBD will see an explosion of colour when our large dolphin sculptures swim into town. So this is part of the wider campaign. These are the larger dolphins. A lot of you have adopted the smaller school dolphins, but these ones are the big message to the whole community. They're also going to spread the messages of our campaign with a wonderful dolphin trail. It's an art trail throughout the city, and the dolphins will be placed strategically around the CBD. We encourage all of you to consider this as a fun school excursion for your students. It's free. There'll be a downloadable app where you can link in and learn more about mental health, wellbeing and awareness, and also learn more about the campaign. At the end of that trail, at the end of March, there will be an auction, which we hope many, many stakeholders and companies and sponsors and the general public will help us to raise funds for the child mental health services here at PMH. So what about your little school dolphin? Well, they'll be invited to join the farewell event in March. This is a great opportunity to bring our pod of school dolphins back together and to showcase your school's wonderful work. So please let us know if you would like to join us in that. We hope you do. Just a few more things. Obviously, our aim is to reach all schools in WA, and regardless of a child's background or circumstances, mental health is a major issue in all our schools. So we've come up with some challenges, which we hope you adopt. So there's some photos, first of all, of your school dolphin and some children engaged in some wonderful art. You can see the large and the small there together. So this one is the hospital dolphin that we'll be giving to the children at the hospital as part of their education. To the challenges. So we have 3 big Splash WA challenges. These were originally devised for schools, but we've had such a great response from sponsors and companies that we've decided to spread them wide. So please, if you're parts of clubs or other groups apart from schools, think about doing one of these. The first one we have is the Big Splash WA shout out. So this is a wonderful way to lend your voices and send a loud, clear message about the messages of the campaign. So it's down to a general idea of grabbing as many people as possible together, teaching them a little rap or a chant, filming it, and then nominating another group or school to do the same thing, and just get that ripple effect going. The second one is the dolphin pod. So I'm sure you've all seen those beautiful drone photographs of groups of people forming a shape together. Well, we're calling on everyone to gather their friends, have a lovely barbecue or picnic on a wonderful day, maybe choose Mental Health Awareness Week in October, and get out the drone photos and get up there and film a shape of a dolphin and share it, post it, Facebook, like it, everything. And then the most fun one, the best challenge of all, we have the Dolphin Dance. So Julie did mention the Dolphin Dance earlier. And we don't have all the details just yet, but we will be launching our own Big Splash WA Dolphin Dance. And we invite everybody to get involved. It's going to be fun and catchy, and it will be a great way to celebrate the spirit of the campaign. So I hope you'll get excited about those. If you would like to learn any more about any aspect of the Big Splash WA, please come to chat to myself, Ruth, or Deirdre afterwards. She's down here. And we'll be able to help you in any way possible. So I think it's time to showcase. What we'll just do, yeah. We actually have Shenton College, who are one of our wonderful schools taking part in the campaign, have put together their own shout-out. So they're right in there and doing it already. So we received this today and we'd love to show it to you.
I'm Jono and we're Shenton College. Hi, I'm Jono and we're Shenton College. Together, we're participating in the WA Big Splash Shout-Out Challenge.
Did you know that 50% of students don't get the help that they need?
But we are not alone! Together we are stronger! Together we are stronger! Together we are stronger!
Can you help turn this splash into a massive Aussie wave? There is help available at Big Splash WA. Join us and make a difference, because it's your voices we want to hear. You can make a difference because...
Together we are stronger!
So there's some inspiration for you all, and we hope to see many more of those wonderful videos. Finally, ladies and gents, I'd like to extend our sincere thanks to some people in the room today. Chris Stafford, who is our education writer, so thanks to her, we've helped to put some of these kits together. Teachers, psychologists and dolphin experts. We have Marnie here from the River Guardians, and she also has some information she'd like to share with you afterwards about the wonderful Swan River dolphins and ways in which you can bring your children down there, consider it as a mindfulness exercise perhaps, or get your parents involved in learning more about the dolphins that live in the river, which is wonderful. We'd also like to thank all the principals' associations for their support and endorsement of this campaign. Eamon and Robert from the Perth Children's Hospital IT and video conferencing team, thank you. And thanks again to everyone who dialed in and joined us from far away today. Lou and Ocean Adventures couldn't be here today, but they have generously donated a wonderful high schools prize. So that will be revealed later on in the campaign, and we thank them for their support. Also, finally, to Anthology, who have designed the incredible Big Splash WA graphics, and you'll see their wonderful work throughout the resource kits. Caroline and Julie, we have something special for you. Thank you so much for all your work and your dedication to this project. We know you're already very busy, but thank you so very much indeed. Thank you. Thank you. So before we finish, to our Big Splash schools who have already adopted a dolphin, please don't forget to collect your resource pack in the foyer. This includes useful fact sheets and resources, as well as hard copies of the primary school kits. So we will be releasing the senior school kits later next week. Unfortunately, we had some difficulties with that, but they will be available soon, and all of the resource kits will be downloadable as of next week. So you will be sent an access code so that your school, if you've signed up, can access those and share them with your colleagues, your students, and most importantly, your parents and your community. So thank you once more for coming along. And please stay and have a little mingle afterwards, meet each other, perhaps share ideas with colleagues from other schools. Thank you, everyone.